Hello, radiology technologists. Today we will have a brief discussion on the complexities of sex and gender and the impacts it could have on us as radiology techs. A lot of the time we think of sex and gender as the same thing, but they are actually quite different. Gender refers to the behaviors and meanings that society assigns to males and females based on perceived distinctions linked to sex or anatomy. For example, females in North American culture are thought to stay home, cook, clean, and raise children, and males out working and earning money to support their family. Gender is posed by society. Sex, on the other hand, is biological. It is determined by the anatomy of a person. When looking at males and females, you notice the difference in physical appearance. The patient who is born female, who wants to be male now, could pose as a problem when it comes to needing a urine sample to test for pregnancy before a radiograph or CT is done on the patient. Now that the patient identifies as a male, they could feel offended if asked if they could be pregnant and give you every excuse in the book why they aren't, even though protocol says to check for pregnancy. Without the pregnancy test, we can run into a risk of radiating a fetus and a potential lawsuit. For example, Dorothy is a patient with 2 kids who has been seen at a facility a few times. A few months later, Dorothy comes in for abdominal cramping and now wants to be called Darnell and identifies as a male. Without educating our staff, we could come across as rude, insensitive, or homophobic. So with a lack of gender-based prevention, management, and therapy, we could negatively impact the patient's unborn child if we don't know how to or want to speak to the patient and possibly offend them. We should be aware of the pronouns we use. New approaches that can be used would be advertising your healthcare services in the LGBTQ community. You can rewrite your intake form to include chosen name in addition to legal name, as well as a third blank option for sex, gender. Do training in your facility and know that not every transgender that walks through your doors is a training opportunity. The main thing to remember that with benefit both male and female is to keep in mind that you should treat transgender individual as you would want to be treated and keep the focus on care rather than indulging in questions out of curiosity. Thank you.